All right, hey everybody, welcome to your Sunday special. I'm Dr. Paige Hubert, and today we are here with the fabulous Dr. Christy. She is a chiropractor here in Melbourne. She specifically is certified in the Webster technique as well as a bunch of other things. I love her for the Webster technique because she works really well with my pregnant mom, as that technique is specifically for
Hi, I'm
pregnancy.
Dr. Tiffany Christy. I am owner and chiropractor of Christy Chiropractic, located in downtown Eau Gallie in Melbourne, Florida.
Yeah.
Thank you for having me.
Of course, I'm so excited because as a physical therapist, I know a lot of things, and as a chiropractor, you are such a great adjunct to what I can do, because I don't really like to mobilize, I like to mobilize, but I don't like to necessarily crack backs. I'm a tiny person. It just doesn't work well for me, and I definitely don't touch the neck. So to have you as an ability to send people to is really exciting for me, and it's definitely something that my patients need. So if you wouldn't mind, kind of give like an overview, kind of a little bit of what chiropractic is, what you do, and how you got into chiropractic.
What chiropractic is? Well, that's a great question. Without talking for 35 minutes. So the gist of it is that chiropractic adjustments, we create normal mobility in the spine. And the real question is, why is that so important? So what can happen is that if we think about it, right, the brain communicates through to the entire body through the central nervous system, right? And that spine houses the spinal cord. And that at every level, it branches off and goes to not just muscle and tissue and bone and can cause pain, but also really affects every organ system in the body. So if we think about it like that, what happens is that the spine can get subluxated, and that's our word. A chiropractic subluxation is a word for a fixation or a segment that's just not moving like it should. And so what chiropractic is, or what we do as chiropractors, is that we create normal range of motion into the spine. Mm-hmm. When we do that, your body literally functions better. The communication from your brain to the rest of your body is functioning better, is working better. And so it helps pain as well, right? It decreases inflammation, blocks certain pain receptors, just helps the body function and create symmetry in the body, but also is great for kind of global health as well.
So what you're saying is that you don't just have to be in pain to come see you.
That's exactly right. All you need to have is a spine, really. Yes.
I think we can all check that off the list. I do really want to hit on the pain, though, because we are in the middle of a pain segment. Go ahead and tell everybody normally what you're seeing and like what you see the most for pain. I'm sure it's probably low back pain. And then like kind of like what it looks like to be treated by you, and how long and or necessarily some details about what that looks like.
So I would say our primary complaint that walks in the door all the time is low back pain, and chiropractic can help that greatly. Other big ones are neck pain, headaches, sciatic pain in a lot of pregnant patients, right? Because we have a lot of shifting of the pelvis, which is your expertise as well.
So much moving.
Yes, and so sciatic pain too. And then of course neurological symptoms, numbness, tingling, radiation as well. So what chiropractic does is that if you think about it, we have a loss of range of motion and asymmetry in the body, which I spoke about earlier. Mm-hmm. When that happens, your body is not functioning 100%, and so that causes shifting in the muscle groups, shifting in the spinal sections. Different part of the spine is compensating for the area that is fixated, and that causes pain. It causes cellular inflammation, and it causes pain not just in the area, but it can radiate as well. Mm-hmm. And then it can also pinch a nerve, right? That's our layman's term, or create some spinal pinching of the nerve there coming off of the spinal cord, and it can cause that numbness, tingling, and radiation, which is like that big sciatic pain that everyone hates.
Something I've been getting a lot of lately is I've slipped a disc.
Oh, yes.
How much are you guys really dealing with the disc, and what does that look like for you?
So when people slip a disc, generally it is a layman's term to say slip a disc. Mm-hmm. It doesn't really slip too far out, but yes, it can herniate or bulge. Mm-hmm. And so when we're doing a chiropractic adjustment, we're kind of creating more extension in the spine, which will actually help push the disc anterior and take pressure off of the nerve roots. And then with stabilizing, insert physical therapy, we can prevent further injury from occurring.
Definitely. So for a lot of our patients, we're seeing a lot of chronic pain. Mm-hmm. Do they have to be like, oh, I did this last week and Dr. Christy helped me right now? Or are you seeing a lot of chronic pain as well?
So chronic pain, absolutely. Because really that chronic pain was not always chronic. It at some point was acute. You had a day where you started to feel pain. A lot of us did not feel pain while we were children, right?
So true.
So things, repetitive stress, micro trauma or macro trauma. So whether that be, a motor vehicle accident, a slip and fall, or poor posture, we're on computers all day, typing away, or
driving,
on our phones, just scrolling.
Like this.
Yes. So that's what I call micro trauma, right? Because
Yes.
it's repetitive stress. Will build up and eventually cause pain symptoms. Pain is your body saying like, hey, something is wrong. Let's do something about it. It doesn't mean that it didn't start a week ago, a month ago, a year ago, 10 years ago. It's been just manifesting, and finally your body's like, I've had enough.
Yeah.
Like, please take care of this.
Do something.
Yes, I don't want to live like this anymore.
Exactly. Yeah, so that's beginning to be such a really big portion of what we're seeing as healthcare providers, is that we're getting a lot of chronic pain because nobody knew what to do about it before now. Or you're like, oh, it'll get better, and then it never does.
Yes.
So I know for a lot of pain, that's going to be a really big issue and probably going to be the subject of our next video, so tune in. So is there anything specific about you and your office that might be different from some of the other chiropractors in the area?
Sure, absolutely. So I'm going to use this term. I'm sorry if I offend any other chiropractors out there. I'm not a rack 'em and crack 'em clinic. So I like to spend a little bit more time with my patients. So when a patient comes in, or we do a new patient exam, which is roughly an hour, 45 minutes to an hour. I go through a slew of orthopedic, neurological testing as well, full history, full exam. Then I spend about a half an hour on that second visit kind of going over that results and treating the patient. I do also have digital x-ray in-house. So if something has been chronic, ongoing for a long time, we can literally see what is going on. So I like to have that here so I can kind of take it a step further right away. After treating and doing a chiropractic adjustment, sometimes I go down and do a little bit more stretching, a little bit more active rehab. I am a certified chiropractic sports physician, as well as having a secondary specialization in peds and pregnancy. So I like to do some active rehab too. Short and sweet, kind of giving some before and after activity, before and after, stretches and exercises. If you need some more attention, please seek a physical therapist. But nonetheless, yes, so that's what I do here. A little bit more attention to detail. I like to do a little bit more modalities with patients and other practices in the area.
Perfect. And I know one of the big things that I really enjoy that you do is Graston.
Yes.
So Graston is kind of more of a soft tissue technique, but it has specific tools. I have not taken that certification, so I've only got to play around with them. But if there's anything specific that you want to talk about Graston-wise.
So Graston is great. It is used, it's used in the sports world a lot, but to be honest with you, I have used it a million times on patients who just have poor posture and sit at a desk like this and work out their traps. I know we all sit
Yeah,
up.
it's like we're all like, we talk about posture.
So yeah, so Graston technique we use, I say it's like a massage squared or, I don't know, quadrupled, I don't know. Nonetheless, but yes, we use stainless steel instruments to break up knots and adhesions in the fascia. So that knot from carrying your stress in your traps, we can break that apart a little bit more aggressively than a soft tissue massage. Soft tissue massages are also important, but this is very specific, and we just target 1 or 2 areas max at a time. It does create some inflammation when we do it. Redness,
which is normal.
Fatigue,
Inflammation is normal.
All
it's
normal.
not fun all the time, but it's normal.
Absolutely. But it actually can help the tissue heal more organized and prevent further injury in the long run.
Yeah. So I'm going to explain fascia just a little bit and how I kind of explain it to patients. I think it's like the saran wrap of the body. It covers literally everything. Everything has its own saran wrap. The skin, it's like your skin. There's the layer of fascia at your muscle, and there's its layer of fascia. And normally, like saran wrap, if it gets stuck to each other, it's like a whole heck of a mess to get out. So normally within your body, everything slides around and it doesn't necessarily always touch each other. But if you get a bump, get a bruise, sit really poorly with poor posture or different things like that, you can have the fascia start to kind of migrate towards each other, and they're no longer good neighbors and they get all kinds of stuck. So that's when we come in with the Graston, not necessarily me because I'm not doing that yet, but with you to kind of fix that fascia and how it's moving, get it to necessarily do what it's supposed to so that it's less angry.
Yes, Absolutely.
Yeah.
That was great. Yeah.
That's like my favorite thing to talk about is fascia because it's literally everywhere. So yeah, is there anything else that you want our viewers to know?
Well, I also think that it's important to know about what we can do for not only pregnancy but pediatrics as well.
Yes.
I think that's very important.
Yes.
So when we have a pregnant patient, we do Webster's technique, which is a soft tissue release of the psoas muscle, which is, I can talk about the psoas muscle like you can talk about the fascia. It's my favorite muscle. It's so weird, but I love it. So the psoas muscle, the round ligament, so we can do a lot of active release of the soft tissue as well as a pelvic adjustment that allows the pelvis to open up and allow it to function normally and let the baby have as much room as possible to do what it should be doing. And then the other thing too is for kiddos, ear infections, slip and falls, even digestive issues can all be helped with chiropractic care as well. So, really it's a whole family thing. So,
yeah, everybody come see her. She's got all the answers.
Come and see me. I don't have all the answers, trust me.
We'll work on it. Yes. So how's the best way to get a hold of you?
The clinic, 321-339-8876. And then also Christy Chiropractic also has a Facebook page. You can always shoot me a message as well.
Perfect. Well, I'm so excited because I know that I'm going to be sending patients to you, and I'm sure somebody is going to come off this video and be like, I need you. Is it easy to get in?
I try my best to get people in as soon as possible. I would say in about a week, not a problem. We can make it happen.
Perfect.
I will make it happen.
And that's so hard, guys, just to get in with a provider in less than a week. I don't even see my own doctor in a month after I'm calling in.
I know. I don't know if my husband or my family is that happy. I must admit that I'm coming in 2 hours early just today to fit 2 new patients in. So I will make it happen for you. I will try my hardest.
So I'm so excited that I got to come in with you today and just talk about you and like absorb some of this wealth of knowledge. Thank you so much for doing this interview. I'm Dr. Paige, and this has been your Sunday special. Thanks so much for watching. Bye, everybody.
Bye.